Okay, thank you all for joining us this afternoon. My name is Diana Harris. I'm the lead for knowledge translation here at ARACY, and I'm also currently acting CEO, but only for a few more days. Today, I would like to begin by acknowledging the traditional custodians of the land on which I'm coming to you from, and that's the Ngunnawal and Ngambri people. I pay my respects to elders past, present and emerging, and recognise their enduring custodianship of the land. I would also like to pay my respects to the traditional owners of the lands from which you are joining us today, all over Australia, lands that were never ceded. And I give my respects to the elders of the lands on which you are. I would also like to extend my respects and pay my regards to Aboriginal and Torres Strait Islander people who are joining us today. Today's webinar is asking, how can good quality early education and care help support children who are at risk and protect infant mental health? We have a panel today of experts in this field who have some very interesting and inspiring information to give us on this subject. We have Dr Jon Jureidini, who is a child psychiatrist and philosopher from the University of Adelaide. He's joined by Dr Prue McEvoy, who is a child psychiatrist in the South Australian Department for Child Protection, the lead Psychiatric Director there. And we're also joined by Alma-Jane O'Donnell, who is coming to us from Goodstart. Alma is the National Manager of Goodstart's Child and Family Service, and will be talking to us about a specific program that Goodstart have for more vulnerable children, which, going by the recent evaluation, is certainly something that I think a lot of people will value hearing about today. Thank you to all our panellists for joining us today. We are very pleased to hear what they've got to say. We're going to start off with Prue talking us through some of her work. Then we're going to go to Alma-Jane, and then Jon will be leading a discussion among the panellists, which will be your opportunity to send through any questions that you would like the panellists to answer. I will now hand over to Prue.
And Prue has just lost the go-to box. Just 1 minute, sorry.
That's
now I just need to share my screen. So, is that working? Can you see a PowerPoint?
Yes, it is. Thank you.
So what I'm going to talk to today is what can we provide to vulnerable families to improve outcomes for children before or soon after they touch the child protection system. Now, because I can't see my PowerPoint, I know I've missed my acknowledgement, so I will go back. I apologise for that. This all worked perfectly when I wasn't under pressure. So we'll start from this slide. Before or soon after they touch the child protection system, could early childhood education and care be a part of the answer? Now, I'm basing my discussion today on probably 20 years of experience working as a child and adolescent psychiatrist at the interface of the child protection system. I'm a child and adolescent psychiatrist, and I was the child and adolescent psychiatrist for children in care prior to becoming the clinical director of statewide CAMS. And within that role, or within both those roles, I worked in a therapeutic infant reunification service, which was a joint initiative between DCP and CAMS. I'm now working within DCP as their psychiatric lead. So I'm thinking about this from that perspective. So what do we know? Better Start Child Health and Development Research Group in South Australia, led by Professor John Lynch, has been pivotal in enhancing our understanding of which children come into contact with the child protection system, and if they do, what this means for them through the South Australian Early Childhood Data Set. I'm not going to go into any details about that particular piece of research, but I really urge you to have a look at it online. It's fascinating, the work that they're doing in terms of linking data sets with de-identified child protection data. So it's quite, I guess, it just means that we can look at children across time and see what happens to them if they have contact with the child protection system. So what I'm going to actually pick out is just some findings that I think is really relevant to what we're talking about today. So the contact with the child protection system is common. And I think historically we probably thought that those notifications were not significant, but now we know that those notifications are very significant. So if we think about a primary school class of 24 students, and I'm sure all of us who have had children, that would be about the class size, 8 of those children will have had at least one CP notification by the time they are 10. So if you just think, if you do have children and they're at school, 8 of those children would have had a child protection notification. Neglect is the most common form of maltreatment. And it is also probably one of the most difficult to intervene in relation to. And sadly, Aboriginal children are vastly overrepresented. They make up 4% of the population, but they make up 30% of the contacts with child protection services. Another interesting point, which I think I hadn't realised before this research was made available, is that half of the contacts occur by the age of 3. Now, in some ways that makes sense because these families, are potentially being seen by early services. But I think more importantly, it just reminds us that we need to be thinking about early intervention. We can't wait for these children to be re-notified and and then require some statutory response at 9, 10, 11, 12, 13, which we know occurs today. 80% of children who have contact with this child protection system will not receive a statutory child protection response. That means they're either not screened in, not investigated, or not substantiated. So again, that opens the door for us to think about what more can we be doing for these children that are not going to get any form of assistance from the traditional child protection perspective. The other really important aspect of this research is that children who have contact with child protection experience vulnerability on one or more child development domains by age 5. So as people interested in early learning and early childhood care, this is really significant because the child development domains are very broad: physical health and wellbeing, social competence, emotional maturity, language and cognitive skills, communication skills and general knowledge. So what we know is that if they are experiencing vulnerability in those domains, that is going to continue past age 5 and into their educational journey. The other thing that's really important to think about is just the increasing prevalence of characteristics of multiple forms of social and economic disadvantage noted in those involved within the CP system. So now I'm just going to move out of that because what I'm going to talk about now is what does this mean for infants and their mental health and wellbeing. What it tells me very loud and clear is that there are social and environmental factors that get in the way of parents being able to provide safe and appropriate care for their children. And any of us working in the early childhood arena will be aware of this. Infants are at times born into poverty, family violence, drug and alcohol issues, and poor parental mental health. It's also important to remember that they have also experienced this environment in utero. So it's not something that just, starts to have an impact at the time of birth. Sadly, their parents often themselves come from deprived or frankly hostile environments. The other bit of the puzzle is that we know infants are born hardwired for relationship, and they need to be in an attuned and safe caregiving relationship if they are going to thrive. Their brains grow in that sort of environment, and that means that they are able then, within a relationship, to begin to make sense of themselves and their world. Without this, they are compromised. There are times when infants need to be removed from their parents due to the lack of safety within their caregiving environment, and interventions then focus on can reunification take place. And one of the reasons for that is that we know that being in out-of-home care does not have the outcomes that we might, or the good outcomes that we might imagine it does. And there's a myriad of reasons for that. At other times, parents are identified either antenatally or early in the infant's life, and we refer the parents to early intervention services. Our focus at that point is on improving the parent's capacity as the primary intervention and reducing risk factors. This is complex and difficult. In my view and in my experience, specialised interventions are required if we are actually going to enhance a parent's reflective capacity. That reflective capacity is a critical psychological component so that the parent can see their infant as unique and separate from themselves, while also requiring them to hold their infant in mind at all times. No easy task for any of us who have been parents, but even harder for these parents whose relational template is often so skewed. Compounding this are the social determinants of health, which continue to impact on these families, even if therapeutic change is possible. When I was working in the infant therapeutic reunification service, the frustration of our team was enormous when we had worked therapeutically with a mother to the point where the baby could be returned to her care, but she couldn't access housing. My proposition then is that rather than only focusing on eliminating the risk factors within the parents, which at times are beyond our control, can we enhance the environment for the infant by providing them with high quality childcare built on the foundational principle of providing these vulnerable infants with an attuned carer in a safe and enriching environment. Currently, interventions are often offered and some of the risk factors might be ameliorated at a point in time. For example, the parents might reduce their substance abuse, the parents might separate, reducing the risk of family violence, and they might temporarily be supported by mental health services. Even with this, however, the social disadvantage continues, and irrelevant of the other risk factors, in my experience, these families often remain impoverished and socially isolated. Contact again with the child protection system might occur, and at this juncture, the infants are now developmentally compromised, often across many domains. The infants are not only demonstrating the neglect they have experienced, but they are more difficult to parent. I'm not suggesting that we don't support parents to become better parents, but I wonder if offering these infants from the beginning of their life the opportunity to develop and experience safe relationships Be careful both physically and emotionally would also be an intervention that could change the trajectory for these children. Statutory intervention must be reserved for those infants who cannot be safe in their parents' care for any amount of time. My experience is that these parents who have themselves experienced adversity in their childhoods want to do better for their children, but they do not have the resources to deliver this enough of the time. With the development of highly professional, culturally sensitive and relationally based early childhood education and care, we have the opportunity to offer families identified as vulnerable an intervention that, in my hope, could be accessible and free. It could mean that these infants are able at age 5 to transition to school without carrying the scars of variable levels of neglect and disadvantage. Thank you.
Thank you, Prue. A lot to think about there. You're right, you're so right, and I think everyone on this call probably knows that when you talk about the compounding of disadvantage and the way that this rolls down through generations, that's, I think, our real opportunity to intervene. Particularly, as you say, we know that despite everyone's best efforts, children who do go into the care system don't have the outcomes that we would hope for them. One of the things that we know tends to happen is they tend to become parents themselves earlier. And the piece of work that we did here at ARACY last year with young parents who had experience of the care system, many of them told us it was about looking to build the family they didn't have themselves. And if we can support those young people, parents successfully, then we can do that early intervention. We can help those young people to break that cycle of disadvantage. And I absolutely agree that wraparound supports, including early education and care, can be critical in supporting both the child's development, giving them that secure relationship, supporting that attachment, and helping the architecture of their brains grow in the way that we know that brains do need to grow to thrive, and supporting the parent as well. So I'm now going to hand over to Alma, who is going to talk to us about a very practical way of doing that.
Thank you. Someone could share. Thank you. Hoping everyone can see my screen. Yes?
Alma, certainly on my screen, I'm seeing your sort of working view of it. If you could go to the presentation view, that's perfect. There we go.
Okay. Well, first I'll do a little introduction about Goodstart Early Learning. So we are one of Australia's largest not-for-profit early learning and care providers in Australia. Our vision is for all Australians' children to have the best possible start in life. We have over 67,000 of Australians' children in our service. We have 56,000 families and employ over 15,000 people with a total of around 664 centres across Australia. So I believe we have quite a significant impact on the future of Australia's children. To achieve our vision and purpose, we know that all children, such as Prue spoken about, firstly must have a sense of belonging, feel safe and secure. So what I want to talk about is quickly about some of the universal things we do to ensure the safety and security of our children, and then talk about the more targeted programs for our families experiencing vulnerability. One of our we've developed our Safeguarding Children framework. So this is really what we call our look, do, tell, and helps prevent and identify and respond to child abuse, neglect and harm from when children first enter into our service. So really capturing from birth rather than waiting till, as Prue was talking about, 5, 6, 7 of age, by educating as an organisation, embedding it in culture, increasing capability and really giving the child and family a voice. Some of our holistic university for children and families experience vulnerability, really looking at hierarchy of needs. So looking financially, we do have something that's funded philanthropically by what we call our early learning fund. It's where our families and our sorry, have we lost my screen? Sorry, have we got my...
Yes, you're still good.
You still got the screen? Sorry. I've just lost view of that for some reason. So I'll just talk to it. So our early learning fund, we look at families from low socioeconomic areas have access to discounted early learning for at least 2 days a week, which means that out of pocket they only pay $5 for childcare for 2 days a week for our 3 and up children. Some of the other things we do if we're looking health-wise, in South Australia we've been trialling, it's very small at the moment, as Health to Go. And Health to Go, really, we have a nurse practitioner who comes out to our centres, and we have, she does health and development assessments, referrals, and you can really treat minor conditions to sort of avoid the need for GP or some hospital presentations, which we know some of our families find a quite significant barrier. We also then have our allied health for some of our centres that can access, and we are starting to pilot offering some NDIS services to scale up our allied health, which really then can look at OT, speech and child and family service support with families. We can run circular security parenting programs for families as well. And then looking at our real targeted response for our intensive. Our children have experienced significant childhood trauma presentations and at risk of exclusion truly by some significant behavioural things, you know, such as very volatile or withdrawal behaviours. This program's been evaluated by the Adelaide University, and we've had amazing success of over 200 children supporting the inclusion of our children who have significant childhood trauma and really building the capacity of early learning to support these children. So these are just some of the things that we do. We also can connect with external agencies who can come in, such as ConnectEd, and help and support our children even further. So I'll hand over to you now, John.
Alma, I'm just going to give you the heads up that I think your computer might be running out of charge if you've got a chance to plug it in.
Yes, I'm just going to plug it in.
Okay. All right. So I think that one of the things that is clearly coming out in the conversation so far is that affordability of early education and care is a problem. And that's why we're seeing it as an issue in the upcoming election for the first time in certainly my memory that I can think of, that this has been as high up the policy agenda as it has been. We know that high quality, accessible early education and care is a tremendous protective and mitigating factor for disadvantage. But as it currently stands, the families and the children who would most benefit from it are the ones who are finding it hardest to access. So that's just something for us to think about as we go in. I'm now going to call on John to talk to us and lead our panel in a discussion about the role of early education and care in supporting our most vulnerable children and families. Please do feel free to send in any questions you've got for any of our panelists, and I will feed them in at the appropriate time. John, take us away.
Thank you. And yeah, just picking up on that point about the political prominence of early learning and childcare, I do think we need to pay some credit to Thrive by 5 for their very energetic campaign. And those of you who aren't linked up yet with Thrive by 5 in some way, I'd urge you to do that, because I think this is a maybe once in a generation opportunity to make a big difference in this very important area. And I guess one of the things that led to the proposal to put together today's webinar was the recognition of the vital role of ECEC in children's mental health, but I think in some quarters a misunderstanding of what that role is. Some people have been pushing the idea that early learning environments are a good place to pick up children and infants who are in difficulties and funnel them into the mental health or other systems to get support to deal with their problems. Whereas much more important is the role of ECEC in promoting children's mental health through doing what ECEC does, not having to become sort of partly trained mental health workers, but actually getting on with the business of education and care. So that's really what's got us passionate about these ideas. Prue, you and I have talked before about the idea that it seems in order to sort of fend off some forms of criticism that in early child settings, there's a stronger emphasis on education than there is on care, as though care is something somewhat lesser than education. Can you comment a bit on your concerns about that approach?
Absolutely, John. I think, and I think there's probably a cultural element to that, isn't there, in a sense that, you know, as you know, we want our children to achieve, but what we're really talking about, that children will only achieve if they have safe relationships. And so, you know, we can offer whatever we like in terms of learning, but if they're not feeling safe and secure and cared for, then they're not going to be able to benefit from that. And I guess, you know, again, in my experience, when we see, you know, very traumatized children hitting school, you know, it takes, you know, a long time for them to feel safe relationally, to be able to then access any of the curriculum. So for me, you know, if we're talking about early learning and early care, it really is the care that needs to be in bold and in 10-foot letters, because if children are in an attuned relationship, then they will learn and they will be curious and they will be playful and they will be all the things that we know children, you know, small children need to learn. But if they're, you know, not in that space, and I guess, you know, if we think about how far childcare has come, I mean, I can certainly talk about it from a personal perspective in terms of having 4 children myself. I mean, we now understand what childcare should really look like. You know, we have the concept of there needing to be primary carers, particularly for smaller infants. We know there needs to be ratios of, you know, that enable good quality care to be provided. And it's through that these children can then have an experience that they may not be receiving, sadly, at home. And so, you know, they're going to come, you know, the primary place that they're going to have their needs met may well be at you know, an early learning environment, in the early learning environment. So it's just so crucial, and I, you know, completely concur with your thoughts that you know, it is the care that will lead to learning be able to occur. And I think the other bit of that is it's not just about learning, it's about developing a sense of self, it's developing emotional and social competence. It's developing, you know, an understanding of relationships. And we see so many families where their parents' relational template has been so distorted by their early experiences that we desperately need to give their children something different.
Yeah, I think that picks up on your point from before about the fact that that the experience in early learning settings makes children easier to parent for parents who may have marginal skill, and the capacity for the child to get into relationship with other adults makes them easier for the parents to get into relationship with them. And so there's such an emphasis on the importance of this experience in our community, that far and away the most important institution for infant mental health is the ECEC setting. It's not the services that you or I can offer, or government organisations offering family interventions, as important as they can all be. But as a society, we don't pay people who work in these settings properly. We don't, hopefully this will change, but we don't put enough of public money into what is, I think, the best possible investment in infant mental health. Maybe turning to you, Alma, we got talking many years ago about your concern about the fact that the absurdity of infants being excluded from early learning settings, and you came up with a response to that, which you mentioned a little bit before, but I think it'd be worth going into a bit more detail about that process, and in particular how you managed to do it in a way that doesn't require huge amounts of resources and has a positive impact on the rest of the children and staff within that particular centre.
Yes, thank you, John. Yes, look, I agree. I was just reflecting what Prue was saying about school, and I think that's still horrendous that so many of our little 5-year-olds go to school and get excluded from education. That's still very, and I'd challenge schools to think about their ways of thinking about behaviour management and all that for our little ones, because within our organisation that came up many years ago, as you're saying, is that these little ones with such trauma behaviours are at such risk of being excluded from early learning centres. So in a sense, our approach was that, how about if we just took off the whole possibility of a child being excluded, and that's not an option. So what can we do? With that sort of approach, then we were forced to think about, well, what can we do? Because our educators need support in supporting these little ones, and our little ones need support and families. So that's where, by taking off the option of exclusion, an organisation is then forced to think outside the square. What can we do? Came up with the individual intensive support plans, of where what we do is we have really, and it's relationship based. So first and foremost, one of the biggest triggers we hear are these little ones don't have triggers, but the whole trigger is entering into relationships. They've had such a negative experience that just coming into the room and entering into relationships is the trigger of the behaviour. So we create this very intensive one-on-one, initially very great, one-on-one. The educator just enters into the child's world. We find out about the child through their world, and then we learn about the wonders that they can do. What is it about this child? And through that, then the educator forms this relationship with the child, gains the trust, and then starts to build on some of those strategies of, some mindful techniques, from as little as 2, blowing bubbles and things like that will help this child to regulate through the relationship. Then once that's formed, then we start extending gradiently out to other relationships in the centre. So learning to trust 1, trust 2, and through that relationship, we can bridge over to other educators within the room as well, and then other children. So it's quite gradient and goes over 12 weeks. 12 weeks was only truly because it's self-funded by Goodstart at the moment. We've tried to attempt to get that using the innovative solutions, but there's some barriers there. So that's purely reason around the 12 weeks. So over that time, it becomes quite gradient, and we've had such success. And over the 200 little ones we've had, they've all remained included in the service to certain levels of degree. We've also, yesterday I was in a meeting with a mum who was crying, saying within 5 weeks, her little fella who was non-verbal due to the severe environment he was living in is now saying 3 or 4 words and has become popular with his peers, which was something that happened. There was another mum because for the first time ever, she was invited, her little one was invited to a birthday party. She was then suddenly socially accepted within those in the early learning. Nobody judged her, and her son was finally invited to a birthday party, which is quite significant experience to have to be accepted by their peers, for this mum to maybe be accepted into a different cohort of parents. So it doesn't take a lot really when we look at the approach. It's really quite a simple approach. What it does take is organisations to rethink their thoughts on behaviour management and exclusion. And once they do that, if we think about schools, imagine if you couldn't exclude a child from school, because children aren't excluded because they can't do maths, and they aren't excluded because they can't read or write. They are excluded because they cannot regulate themselves. And so then you should consider that as a teaching, moment rather than a time to them. So.
Yeah, I think the rationale for... Sorry,
I just wanted to make the point that when I was reading about this program, Alma, I think you touched on it, but a really essential element of it is the way that educators are supported. So you've got your named educator, and this goes to a question that's come up in here about how you maintain regularity of relationship. And I think it's important to sort of be clear that this educator is outside the normal staffing ratio for that centre, and their focus over the 12 weeks is exclusively on building that relationship with that child. So you've got that continuity for the person who asked that question. And the other thing I think is really critical is that that educator is supported by a member of your team with specific training and expertise in trauma-informed care and in attachment. And they're supported not only to build those relationships with the child, but also with the family. And there was your case study, which looked at when that little boy went into care and was living with his grandmother, and things started escalating again, and they were able to look at that and map that back to the parental visits, and that's what was causing the trigger. So tell us about that and the way that with that work with families, that collaboration, you're able to build in those supports that are really child responsive.
Yes, well, it's about the team around the child, really bringing the team into the centre. So bringing in all the agencies involved in the child in around and having those case discussions about what's happening for the child in the centre, but also how we can support, like this grandmother through some of the learnings that we have in the centre. The whole education team is trained in the trauma-informed practices, and weekly the educator is supervised by someone on the child and family service team who's quite trauma-informed, and weekly we slowly build the plan for this child around what they're telling us. So this little fellow was telling us he just wasn't coping with visits in prison. And so what could we do? We were able to see that because he'd come back to the centre and we could see the impact on him. So meeting with grandma, that's Child Protection Service, and saying, let's listen to what this little boy's telling us. What can we do? What can we do to support so that the education team is supported? We can put in strategies, helping him learn about his own body and some doing mindful things, and then helping grandma as well. So yes.
Can I just make a comment? Because I think, I know, I obviously know you over a long time, Alma, and, to say it's a simple intervention, I think is... No, I know. I think these are really sophisticated interventions, and I know how much work you have put in terms of having your staff supported and them having that trauma awareness. So for me, I guess that's what I was trying to imply. I think too often we think that just supporting parents, making sure they can get the child to childcare or to an early childhood education setting. What is done, what you're doing at those settings is sophisticated therapeutic work with that child. That might not be done by other services, to be honest. And I think, without being critical of the NDIS, I think the NDIS has ballooned so much that we now have, some people working in that sphere that perhaps do not have the trauma awareness that your educators have. And that relational work isn't incorporated into their developmental treatment, if you like, of those children. So, you know, I think it's your awareness of infant mental health and your awareness of the relational intervention as being critical that has really led to these changes in how you're practicing.
Yes.
So a number of, go on, Emma.
Look, it is something that we certainly know that it is a standalone that we're doing within our organisation, and we certainly would be, you know, very open to other ECE organisations or primary school or primary schools learning about this intervention and understanding the logistics of how to implement that. You know, it is all about, we do have, you know, impact beyond Goodstart, and something that we would most, you know, happy to share. You know, as you said, it is quite simple, as I said, but the logistics of that, so that all our children in Australia can experience this sort of intervention.
So I just want to move to some of the questions that are coming in from the audience, and there's a theme developing about, you know, more rural areas where there isn't services available, single, like freestanding childcare settings that don't have an organisation like Goodstart behind them, and you know, Prue's point about just putting children into childcare, can that make a difference on its own? Where's the professional development for people outside organisations like Goodstart? Could one or both of you comment on those issues?
Yes, well, there definitely is. I mean, one of the things COVID has forced their hand is that the intensive model is actually delivered quite now by telehealth. It isn't particularly the most ideal, we thought initially, but we've had huge excesses for those rural centres where we haven't been able to travel to. There are actually services that, like here in South Australia, we have a service called Connect Ed that it can be accessed by any early learning service through innovative solutions that can offer not as an intensive as what this particular intervention does, but can certainly offer ongoing support through a psychologist, an OT, for centres to learn about trauma-informed practices. And they've had some really good outcomes, and they can be accessed through innovative solutions. So there are services that will extend, yeah.
So, and also just to add that professional development is one thing, but equally or more important is the availability of good supervision. So
yes,
the person
absolutely.
on the ground needs some, you know, this is very potentially emotionally wrought work, and it's vital that people taking it on are properly supported.
But I think there's a step even before that, John, because we know that regional areas are disadvantaged because of the lack of early childhood care, full stop. So there really needs to be, I think, a rethink and a valuing of early childhood education and care, so that there is some, you know, equitable answer to this. You know, in the same way that there are schools in every regional setting, we should be arguing that there should be good, high quality early learning centres and care available. It shouldn't, you know, it shouldn't make a difference. And I know there's lots of barriers to that and staffing, etc. But I also think, you know, if we actually prioritise early childhood educators professionally, then that draws people to the sector. You know, for so long it's been, you know, underpaid, you know, and not supported adequately. You know, so I see a lot of parallels in some way with aged care. You know, we've got two very vulnerable populations, and yet we, you know, put very little effort into ensuring their well-being historically. And I'm just delighted that that is changing, you know, within the early childhood education setting. And hopefully it might change within the aged care setting as well, because I think, you know, there are lots of similarities.
For another question for you, the question relates to, is does this require engagement, like the protective effects and the relationship building effects of this experience? Does it require the centre to engage with the parent, have the parent involved on a day-to-day basis, or can you help these children and families without having terribly much contact or out of the ordinary contact with the parents?
Look, I think that's a really interesting question, and I don't know the answer, but I think what I would like to see is some research in this space in the same way that we're, researching early intervention services. I think it would be really interesting to look at, almost a dose response. How often do these children need to be in an early childhood environment to have an impact? In an ideal world, I think you would want to engage parents, and I think Alma alluded to that in terms of, the anecdotes that she has shared with us. But, we also know quite pragmatically that there are some families that you can't engage. So, there you're tossing up, do you provide something to this child who we've identified as being vulnerable that might enhance their development, or do we disadvantage them yet again because their parents aren't able to engage as we might see fit? So, I think, I think it really, needs to be thought about very carefully in terms of, for me, it's about how do we create some equity for vulnerable children. And I'm not sure that we're doing that at the moment.
Question maybe for Alma. It's a question about what's a kind of minimum dose. How much time in the centres do, first of all, the kind of potentially excluded children, what's the ideal amount of time for them to be spending there? And just for the ordinary child who needs a bit more than they're getting at home, what's the kind of minimum dose for them?
Look, when I look at all our intensives, our most successful, highly good outcomes come from children who have attended 3 or more days. I think it offers predictability, consistency. You're able to get some more traction. They're getting to engage with the educator more regularly, especially our children who, come from residential care and come from, multiple foster carers over and over, just to have, 3 days a week at least of one predictable environment where everyone to your world rather than you going out to everyone else's world. Just has, I would highly say, at least 3 days, and that's like with our early learning fund. That philanthropically funded does 2 days, but wouldn't it be ideal for our families to be able to get 3-4 days of $5 a day, early learning to get our most vulnerable families in that, So I certainly would be highly recommending 3 or more days. Yeah.
So Diana, you filled in a couple of questions about language. Would you like to make a comment about that very important issue that the care is used as a kind of dismissive term? Anybody can do that. You don't need to train people to do that.
Yesterday, I read an article about, it was a rundown of the different candidates for a leafy suburb, which we will not name. And one of the questions they asked was, what's your position on childcare? Because that's what people keep calling it. And one candidate, who we can, profoundly hope will not get up, said that there was too much red tape for educators, that they didn't need all of these qualifications, and billions of people around the world have successfully raised children without any qualifications at all, and why were we doing this? So, clearly there is a long way to go. And I think this is why certainly in the Thrive by 5 campaign and a lot of the folk in the sector do specifically talk about early education and care, because it is more than keeping an eye on kids as they run around. And this is also why we bang on about high quality education and care, because it's got to have, if it's going to have all of those benefits about helping children's brains develop, about supporting these strong relationships. What I find ironic is that all of the skills, like emotional regulation, all of that executive functioning stuff that is so strengthened and supported by good early education and care, is all of the stuff that they bang on later on about snowflakes and resilience and, you know, people should just be better. And yet we're not taking these opportunities to support that development at these absolutely critical early stages. Now, Prue, you did make a good point, which is that by focusing on education, sometimes we move away from the care. But I think there's still such a long way to go to help people understand what children need to thrive. What do you guys think?
Yeah, I think it's a really interesting language, isn't it? And I guess I'm obviously, come from a generation where it was only called childcare. So that's where I sort of slip up a lot. So I apologise for that. Yeah, I guess I wonder if it's, if education is the best, is the best noun, in a sense to call it. Is it early childhood learning? Is it early child development centres? I mean, I think we probably use education because, as you say, it does sort of, people know that you're focusing on a higher level. But I just worry that it takes us into a place where, when we might, in some circumstances, and I'm not talking about in a vulnerable population, probably more of a non-vulnerable population, the emphasis is on, my child going to school, able to read, able to write, able to, count up to 100, whereas we're talking about much broader developmental considerations, about being able to regulate, about being able to have some, emotional stability, some social competence, some relational, competence. So I just, I just not sure how we illuminate the breadth of what early childhood education and care is actually about.
Okay, I think we're unfortunately there are several more questions that we won't have time to address, but thank you, and I'll hand back to Diana to wrap things up for today.
I think we could easily have gone for another half hour, guys. There's lots of questions and also lots and lots of support and shared frustration. There are some specific questions about what are good professional development resources for educators, questions about how do you manage families who've got high enrolment rates but low attendance rates. I think that this is obviously a subject that we could stand to revisit, and certainly ARACY does have a full program of webinars over the course of the year, so I think we can certainly hope to get you guys back to answer some of these more detailed questions. I would like to say thank you, a huge thank you to these panelists who have given us their time and expertise today. It's obviously very, very valued by the people who have joined us today. One of our most popular webinars, I'm pleased to say, so well done everybody. As always, this webinar has been recorded. It will be available on the ARACY website over the next few days. We will be also sharing the slides, and if we can give a little bit of additional information about where to find good professional development resources, we'll put that up as well. If you want the latest information about children's wellbeing, please join the ARACY mailing list so that you never miss one of our webinars. If you're interested in supporting children in their early years, this critical phase of development, signing up will also connect you into the Early Years Catalyst. And that's a group of sector leaders which formed out of ARACY's 2020 Early Years Summit and formed out of that clear appetite that we all have across the whole child development field to do better for our youngest children. And if you care about all children being able to access high quality early education and care affordably and all over Australia, please head on over to Thrive by 5 and join the campaign if you haven't done so already. Thank you again to all of our panellists for being with us today, and thank you to everybody who has joined us to hear the importance of early education and care for vulnerable children and families. Thank you.
Thank you.
Thank you.